Good afternoon, everyone. Thank you for coming. I'm Pam Schaff, and I am the director of the HEAL program, Humanities, Ethics, Art, and Law program here at Keck. And today's event continues our program's mission to align the work of artists, patients with the core medical school curriculum, and to foster enhanced understanding between patients and future healthcare professionals. Today we're joined by Dr. Sigita Cahoon, an assistant professor in OB-GYN, and the chair of the reproductive system that our students in year one are currently studying. Dr. Herr unfortunately can't be with us, but we're pleased to welcome Dr. Emily Dossett, who's an assistant clinical professor in psychiatry and obstetrics and gynecology, and she runs the reproductive psychiatry program at LAC USC. I'm going to turn things over now to Ted Meyer, who's our artist in residence, and I'll allow him to introduce our artist and to introduce our program for the day. Thank you.
Hi, thank you everyone for being here, and I'd like to introduce you to Cathy Immordino, who is, some of you might know, she was a kid actor. She might have been on some of your favorite TV shows when you were a child, but she's also a great photographer and has an amazing story for us about her pregnancy. So I want to start, normally I just jump right into things, but in this case, I sort of have a little statement because being a guy, this is a little out of my wheelhouse, so I'm going to rely a lot on the doctors here and for Cathy to tell her story. Most of the artists we've shown have had mobility issues or pain issues or organ transplants, things like that. And those things were easy for me to relate to, but Cathy being a pregnancy, obviously I can't have a first-person relation to. But I look at her photos, and I was a very sick kid, and I can relate to the isolation of her long bed rest and being home and having the rest of the family have to watch you be sick and having the lack of privacy in the hospitals and things like that. So that's where I'm coming from on this. I'm not going to talk about medical things at all, or I'm leaving that to you guys. But if you look at Cathy's photos, I think you'll really see there's a strong psychological element to them, more than a lot of our other artists, and that I can relate to. So here's a bunch of facts for any of you students that want to get into this field. There are lots of babies born every year, and as I was going through this, I was sort of surprised by the number of miscarriages, like almost 25%. You know, you always think of birth as happy, and on TV it always goes so easily, but there's a lot of things that go wrong. And if you look at these numbers, the number of miscarriages, how many are in the first trimester, a lot of infant deaths, things you don't really think about because you always sort of expect that it's going to be happy. Here's Cathy's timeline, and if you look at it, you can see that she spent a lot of time on her back during this pregnancy. And again, I had never really seen this before. All my friends that have had children and successful pregnancies, they were out doing things until the last couple weeks when it got really uncomfortable for them. So with all these things in mind, let's start talking about your timeline. And when you decided while sitting in bed, hey, I'm going to make an art project out of this, all right? All right, so why don't you talk a little bit about your schedule before we get into the art or your...
Oh, my schedule. Okay, so at 6 weeks gestation, I started hemorrhaging, and we thought I was having a miscarriage. I wasn't even aware that I was pregnant at the time because I had a miscarriage about a month and a half before this. So at 6 weeks, I was hemorrhaging. I went to the emergency room. They discovered I had a high titer level, and you guys can talk about that later. So I had a high titer level, and then my OB came in, and he said I had a blighted ovum and told me we can do a DNC. And I refused. DNC is whatever you call it. What do you call it? Yes, that thing, where they take the whole thing out. And I was like, I don't want to do the medical invasive part of this. I'll just let it naturally happen. And so since I decided that, he decided I should go to another doctor that had a higher imaging thing, MRI machine, I think. And then he looked, or sorry, it was ultrasound, and then he looked and they actually found a heartbeat at 6 weeks. So then from then on, I was stuck on bed rest at home from 6 weeks until about 28 weeks when I was actually hospitalized.
Anything else on your chart?
I can't read that part. Let's see. That was the heartbeat, revealed, ruptured. Oh yeah, so what they discovered that led to the hemorrhaging was I had a tear near my uterus, and that was what was bleeding. It wasn't actually the baby. So the pregnancy was viable still at that point. I mentioned antibodies.
31 weeks, became deathly ill.
Oh yes, at 31, thank you. At 31 weeks, I caught something in the hospital. I was hospitalized at 28 weeks. So at 31 weeks, I caught something in the hospital. And they weren't sure what it was. They didn't know if it was the baby doing it to me because he is E positive and I'm anti-E. And those are blood types that nobody ever really hears about. They're the smaller groupings. And so at 31 weeks, I started bleeding out of my nose and my ears and my eyes, and everyone was afraid because it was the time when Ebola was hitting, so nobody wanted to touch me and look at me. And the nurse came in and they did the stool sample and they did all this blood work, and they could never figure out exactly what was wrong with me. So that just kind of happened at 31 weeks, and then they decided if you can make it to 34 weeks, we are going to deliver your kid, because it was the whole better out than in scenario. So then at 34 weeks, we had an emergency C-section. And then I stayed in the hospital for a few more days, and my son stayed there for 16 or 17 days in the NICU.
All right, so let's talk about when you decided that this would make a good art project, and talk about this sort of shocking view of pregnancy here.
So I'm naturally a photographer. I naturally document everything. And so anything health related for me is all end of the world scenario. So it's like, I'm gonna die no matter what happens. I'm definitely going to die during this. So I photographed every single thing, like every story of telling my own story of it. And I posted on Facebook along with descriptions. So if I did die, there would be some sort of history that people could be like, oh, this was like her last will and testament as a photographer, as an artist. So this was like my first, I guess, series of, changing from a photojournalist, because I used to photograph like the Playboy Mansion and raves of LA. And so it's changing from that sort of documentary thing into turning the camera on myself and documenting my own story, my own situation. So it pretty much started with, I think, this image, which was around 6 weeks when I hemorrhaged. So then I was like, I need to make a photo with the pregnancy test positive and all the blood. But then later, the series further evolved into photo montages.
All right, so I'm going to go through, Cathy and I have sort of divided these photos up into during pregnancy and after. And I'd like you to talk about the psychological aspect of them, because to me, again, they're pretty haunting, I think. And then if you can kick in on some of the medical problems she had. All right, why don't you start here? So
this photo is 2 photos put together, but the portrait in the back was me actually the day before I was admitted to the hospital for the 7-week hospitalization. And this photo is called I Made This, because internally I felt like this was my fault. This was all happening. I did something wrong, even though it's like internal medical based, because it had to do with blood titers. Incompatible blood, and I assumed that was the only reason. But I also had this really bad cough. That they couldn't figure out what was causing my cough, and they decided, after x-rays and stuff, that it wasn't pneumonia or anything like that. But every time I coughed, I would start leaking fluid, because at 28 weeks, the night of this photo, at 28 weeks, I started leaking fluid, and it was this white fluid with like a silvery metallic shine to it, and that's what led me to the ER the next morning. And then the knitting on top, it's something I learned how to do in the hospital. The nurses taught me how to crochet or weave on one of those wheel things. So then I started making these little hats as something to help pass the time. And it became like this poetry of sort of, oh, it's like I'm healing myself or weaving myself back together or making something. So then I put these 2 photos together because they both kind of tell that story, like within one picture.
So you're the one that has to deal with everybody's insecurities and nervousness during all this. So here she's at 28 weeks. She's been on her back for 22 of them. And so how do you get someone through that? I mean, she's got these problems. She might lose the baby. She's got to stay busy and do something other than watch cable TV, I assume, while on back. How do you walk someone through that?
Well, I mean, there's a lot to say. First of all, you're really brave to get up here and talk about this.
It's been 8 years.
So, still, I mean, I look at these images, and the one of the, in particular, the pregnancy test in the blood is just, like, very shocking. And I actually, when I saw this one, my first thought was that you felt like your voice had been taken away. Like you were just, didn't have a say, basically, in what was going on. So I work with the women here in the high-risk OB clinic where Sigita trained and worked. And so the women that are there, she can attest more than I, medically have all kinds of issues going on. They're just very medically complex. And so with that goes a lot of anxiety. And one thing as a psychiatrist that we always try to delineate is, some anxiety is actually a normal emotion, right? Like anxiety is something that, it's the thing that makes you study for that test and when you don't want to, or it makes you, motivate to plan, I don't know, whatever it might be. So it's actually a motivating factor, but there is a line that gets crossed. And so the things that we look at in someone who's dealing with a situation that's very anxiety-provoking is really how is it affecting their day-to-day functioning and their emotional functioning. So really it's kind of that word functioning, right? So are they sleeping? Are they eating? Are they able to relate to their other children, to their spouse? Are they able to, wash their face, brush their teeth? I mean, sometimes it's as basic as that. We have women who just can't even get out of bed to shower sometimes. They're so anxious or depressed. So, if I were working with someone in your situation with this level of medical comorbidity, like I would 100% expect them to be anxious. If they weren't anxious, that would very much concern me. But then the question is, how far has it gone? And if it's gone to a point where we need to actually intervene, whether with therapy or potentially even medication, then we do so. As far as helping women through, a lot of it is the language that we use, and it's never helpful to say, it's gonna be okay, because you have no idea if it's gonna be okay. It's never helpful to say, don't cry, or don't be sad, or it's all gonna work out, or you have the best doctors, or blah, blah, blah. Like, that reassurance typically isn't reassuring. Like, what's helpful to say are things like, I can't imagine how you must feel. Can you tell me about it, right? Or it seems to me that, there has to be so much worry going on right now, to really try to help that person name their emotion. And the last thing I'll say is that in pregnancy in general, with any kind of depression, anxiety, whatever, and this directly addresses what you said about feeling like it was all your fault, there's a group that's very common. And there's a group called Postpartum Support International. It's like a volunteer network who works with women in these situations. And they have what they call the universal message. And it's 3 points, and it's really basic. And I'm assuming a lot of you are in medical school. And so take this with you because it's extremely helpful. The first point is that you're not alone, right? Because people feel very, very alone. And you saw those numbers. They're in the hundreds of thousands and millions, so you're certainly not alone. The second is this is not your fault. You're not to blame. There wasn't a single thing in the world that you did about this. And then the third is that with the right help, you can get better. But you have to emphasize that you need help. No one's expecting you to pull yourself up by your bootstraps, pray it away, talk it away, whatever. Like, you need the right help. So, you're not alone, you're not to blame, and with the right help, you'll get better. So that's a phrase or phrases that I use pretty much with every patient that I work with. I feel like I've been talking a long time, so I'm gonna let you.
So let's go through a few of these during pregnancy slides.
So this picture is called Hazard. This was at 31 weeks when I started hemorrhaging. And it combines the photo in the back is the photo I took right when I started having the fever and I was vomiting and bleeding out of everything. And so that was that moment. I actually photographed myself. I did this on the iPhone. I think I forgot to bring that up before because I couldn't hold an actual heavy camera. And then the picture of the Hazard with the arm, every time I was like allowed to take a shower, I had to put a bag over my IV so stuff wouldn't get in. And so once they gave me a bag that was a Hazard bag, and then they taped it to my arm so I could go take a shower. And so I photographed that like 20 different times probably. And then putting these two together, it just became like another level of poetry because the Hazard thing, the doctors thought I had Ebola at one point, and then they couldn't figure out what I had. And I was like, I've been in the hospital for weeks. How do I get Ebola? Sort of thing. But it was probably the respiratory guys brought something into my room because I was on stuff to try to calm my cough the entire time I was in there. But yeah, we never figured out what I had exactly wrong with me. But that's what this photo represents. So that kind of turning point at 31 weeks. This picture is called Toco Baby. So they put a Toco monitor on your stomach to monitor the baby's heartbeat and signs, vitals. And so you constantly hear this sort of heartbeat sound in the room, and it becomes this sort of drone that adds to, I guess, the mental breakdown of things. But you hear this constant thing, and you have to tell them to turn it down. You're like, I don't want to hear the baby's heartbeat all the time. You're making me paranoid. But he would always push out against the Toco monitor, and that thing also left blisters and stuff on me because it was on for 7 weeks. And every time I moved, it would like rub against my skin. So that's one of the things I don't think most pregnant women have to deal with is wearing that thing tightly strapped to you for 7 whole weeks. Yeah. This one goes together with that the self-portrait called I Made This. This one's called Strings and IVs, and it was sort of like a symbolic representation of how I noticed that, the strings that I was weaving together to make all these scarves and hats and stuff while I was in there. It's very symbolic, I guess, of the IVs because the IVs are like saving me and I'm healing myself back together, sort of like building myself or knitting myself back together. So this is me like rebuilding myself in this picture, I guess you could say. So the string and the IV become one, they merge in together.
So were you doing the Photoshop work and the collage work while you were laying in bed, or was this done afterward?
No, so I documented the entire thing with over 1,000 photos via iPhone. And if you scroll back in my Facebook, you can actually read each picture with each detail, but they're just the regular documented photo. And then a year after this, like I couldn't mentally get over the experience and the trauma of the whole event. So a year after, I started photo collaging things together to try to tell my story. And I was working with one of my mentors, David Spindler, and his wife, Cece Spindler, and they helped me kind of not photo montage the things together, but just talk about it and talk about the experiences. And it was very therapeutic, and I was like, crying the whole time, but making these images and just, I guess like therapy, but without going to a therapist, just talking about it. And because that's like the beginning of the healing process, is just to talk about it and get it off your chest. And then try to find other people that hopefully went through something similar, which nobody has. But, like trying to share it. And if you over-talk something, sometimes it's easier to, I guess, move on. I mean, I'm not crying yet, so we're doing good. Anyway, this one's called Hallucinations. And so this is the moment when I was being wheeled to the emergency room to have an emergency C-section. I took my phone everywhere and I documented everything. That's like so wrong of me, but I'm a photographer, this is what I do. And then that photo is of my son Dino when he was in the NICU with the feeding tube coming out of his nose. And he used to get these serious migraines and he would grab his head and he would just scream bloody murder. And there's another picture where he's like pulling his hair off of his head. And that was something that was very common for him for about the first year and a half of his life. And nobody ever figured out what was going on with that whole scenario. But the creation or the inspiration for this specific photo was at 31 weeks when I hemorrhaged and had the fever, and we were both tachycardic. Our heartbeat was off the chart, and it wasn't looking good for either of us. I had this moment where I could see like through the birth canal, and I could see like his image, and he looked the exact same way when he was born. It was kind of weird that we had this sort of telepathic connection. So that event inspired this photo.
So we'll stop here.
Yeah.
Now let's talk to you. So let's talk a little bit about her history. Did you see anything that you hadn't seen before? Other, Ebola? I'm sure Ebola doesn't show up a lot in your pregnancy.
We were sort of, when we were getting organized to start, we were talking about some of the events that happened, and she brought up the Ebola scare that happened, and I was like, oh, I remember that. I remember that there were signs posted at the hospital, have you traveled to Africa? Have you had any symptoms? And it was like a prequel to COVID, which became so much bigger. We thought when COVID started, it might go the way that the Ebola scare did, and obviously it's changed everything. But I can see at the time where people felt anxious, then you develop these strange symptoms, how unfortunate of a coincidence that was for you. There was a couple things that stood out. One is, first, thank you for presenting all of the numbers about pregnancy complications, because the kind of common understanding of pregnancy is that it almost always goes well, and it's almost always this really positive experience and happy outcome, and that perception can be harmful to people who don't go through that experience, because actually, miscarriage is very common. Complications and hospitalizations can happen very frequently, and then that narrative isn't really ever told, and so women who are in that experience feel like, what is happening? What did I do wrong? How could this have been prevented? When actually it's part of the spectrum of pregnancy experiences that can happen that are very infrequently talked about. So this photo essay is amazing to see, because in medical school and as a doctor, you often don't hear what it feels like to be on the receiving end of all these diagnoses, of these treatment plans. It used to be a very common thing to keep people on bed rest for a prolonged period of time, and I think there was a presumption that everyone's goal is to get this baby delivered, when it overlooked perhaps some of the trauma of some of those interventions on the moms. So to keep you in bed for 9 months is a pretty extreme trauma, and so is that even helpful? And so medicine has moved away from keeping people on prolonged bed rest because of the pretty extreme negative effects on moms who are in bed for that long. I think you talked a little bit about having antibodies and titers, and so it sounds like there are all different kinds of blood complications that can happen in pregnancy, and so when mom's blood type and the baby's blood type don't match, the mom's blood can kind of attack the baby's blood. It can cause a lot of complications, so it sounds like some of what was going on for you. And again, it's nobody's fault, and there's no way to prevent it at all. So those are some of the things that stood out to me. The other thing that stood out when you present your timeline and you're talking about your experience, from a medical management perspective, people would say that your story was a success. Like, yeah, you're healthy, your baby's healthy, what a success. But like, certainly that doesn't take into account your experience of that whole ordeal and how it felt for you to go through all of these diagnoses and waiting for the next thing to happen. And I really like your Toko picture, Toko baby. So we have these monitors that we keep strapped to the belly. For most people, that's a relatively short period of time, but for women who are in your situation where you're hospitalized for a very long time, we're measuring your contractions, and we're also measuring the baby's heartbeat. When the baby's premature, often we have to tighten that belt really tight to kind of get the baby, and then it creates like you said, blisters and an impression in the skin, which is like a real like physical representation of some of the trauma that you're feeling. And often they turn up the sound of the baby's heart rate so that everybody can hear it. And I kind of describe it almost as like a galloping sound.
Yep.
And so I can't imagine listening for months to this like galloping sound. And every time it goes down, people rush into the room and there's a problem, and it becomes a traumatizing sound as well. That like you're listening, you can hear some kind of impending danger. There's nothing that you can do about it, and everyone's reacting to it. So there's really so much going on for you, and you captured it really amazingly.
And that thing left crop circles on my stomach, is what I call them, because it was like the imprint of the Toko monitor. So I was like, oh, look at my crop circles. So I'd photograph them all the time. It was kind of fun. Positive outlook.
So since we have, a lot of med students here, let's talk about the stress on you to have to deliver the kind of news to her after seeing her? And also, when do you call her in? What's the process?
I wish we had a lot more access to Dr. Dossett and many more of her. We need that because I think that there's just such an interrelatedness of pregnancy, any medical conditions you might have outside of pregnancy, and then those that develop. And then how do you deal with this? A ton of pressure to do the right thing, whatever that is, whether that's for your health or for the baby's health. And so as medical doctors, we might be interested in it, but don't necessarily have the tools or the words to support moms in that. And so working as a team is where we could do better in terms of doing that. I think what I have tried to develop is giving moms information and then giving them options as opposed to this is what we're doing and that's it. Now, occasionally there are some conditions where there's really only one safe option, and so that's the major one we're gonna go with. But there's certainly a lot of complicating factors that kind of developed and built on themselves in your case. And so, moms being aware of why we're doing it, what is our end point, what's gonna be our decision to move on to the next phase of management. I think patients are probably not that aware of what's going on, and we could do a better job telling them about it.
And then how do you get involved? Do you refer her? Are you just sort of floating around the hospital looking for pregnant people in distress? How does it work?
No, usually we need to, I don't know if you agree, but it's that we have a high suspicion that there's something going on that mom needs some help coping with. Right, that there's a lot of stressors and that she really needs some psychiatric support.
And I never had one of her, never, the entire time. So I don't know if Providence St. Joseph just doesn't do that, or I don't know. Yeah.
Well, now you're a Keck where we do things.
Right.
Well, all right, let's get back to your photos.
Yes.
So you've obviously had your child.
Yes.
And what's going on here?
So this was the very first photo I made for montaging them together. And originally I was going to do this sort of cyanotype process and then layer the color photo on top of it. But my son was born purple. He wasn't breathing, he wasn't screaming. His APGAR score was, I don't remember the numbers, but they were super low. The first one, the second one was better. So this is when the doctors were just waiting, after they ripped him out of me via C-section. They were just waiting to see if he would do something. And then finally he started crying. I think it was a few minutes later. I have no recollection of time at this point because I was bleeding so heavily that I remember my body felt like it was on fire and I was sweating, and they told my husband at the time to leave the room with the baby and go take care of all that while they, tried to save me. But I was losing too much blood at this point. But so in the background, the diffuse type photo is me with the gas mask over my face, which was pretty much me the entire time I was in the hospital with my cough. They were giving me all these drugs like oxygen, but it was medicine. And I don't remember the doctor's name or anything. Or Patel was his last name, but there's several of those here. So you're like, oh, you guys know what I'm talking about. Okay. By the way, my OB and that guy retired shortly after I left the hospital. I'm not pointing anything out, but they made good money off me, okay? So yeah, the photo together with me in the background and the baby being born, this was kind of like that traumatic, moment of, we're both survived, we both made it, but we're both kind of in limbo and almost dying sort of moment. But this eventually got turned into a black and white, and it was the lead photo for the entire series. So this is called Power to Fight. That's my son's foot in the NICU. And if you look in the very back, you'll see all the NICU stuff, the places to plug in and whatever, the monitors. And then that's my ex-husband now, but husband then's hand with the foot to show scale. But yeah, this photo was taken in the NICU, and as soon as he was born, it became his fight because he was 34 weeks gestation, and the monitors kept blaring, signaling that his heart was, I don't know, stopping or whatever it was doing, and he'd make this weird face like he looked like he was choking. And then the NICU nurses would run in and they'd start moving him around and massaging him and stuff to get him to kind of I guess, pink up. I really don't know what they were doing. But at the same time, like again, it's with the monitors. You're hearing all these noises, and it leads to sort of a panic scenario for us as parents in the NICU. So yeah, this photo is kind of like, you know, that positive push towards, you know, like he's here, he exists, and now he has to fight for his life, sort of thing. This picture is called Parasite. Don't think of it negatively. But so the hep lock that's in my arm is what he's sucking on in this photo. Of course, there are two photos put together, but that was one of the moments for him, if you remove the hep lock, that's one of the moments when he was, you know, screaming out in pain because he used to, you know, rip his hair back and grab his head and stuff and scream out in pain for no reason. And nobody could figure out why he was doing this high-pitched squeal. So that was a photograph of that moment in the NICU, and then he's got the feeding tube in his nose, and so I montaged that together with the hep lock that was always in my arm, which became very annoying. But I also found out while I was in there that I was allergic to everything. I was allergic to the adhesive, I was allergic to latex, I was allergic to like a whole bunch of things. So I had this cute little bracelet with all these little decals on it, but that didn't make it into the photo. No, anyway. This photo is called Trapped. So the entire time I was in the hospital, the nurses are like, oh, there's this lovely koi pond over at Providence St. Joseph. There's this lovely koi pond, and, you know, we'll take you out to see it eventually, which they never did. They're like, there's these fish swimming around, and it's a nice little garden, and, you know, if you're having a good day, we'll wheel you down there. And I'm like, okay. I'm like, you just keep telling me that. So that was something I was kind of looking forward to the entire time I was there. And then the railing in the back here, right across the street or outside of my window, was the Disney Studios. And they were working on one of the Marvel comics at the time, so I kept like peeking in the window. I'm like, who's gonna bring me in binoculars? Let's like look at this. So this was like me trying to focus on something ahead that I could look forward to, because had they not given me that sort of hope, like, oh, there's this koi pond and we will take you there eventually. You know, had they not given me that positive thing to look forward to in the future, I probably would have, you know, had some sort of nervous breakdown in the hospital, being stuck there alone with a TV that was broken in the room the entire time. You know, a lot of trauma, but it was fun. So that's what this photo was. This photo kind of ends the series, but it's called Unloading. So it was after I left the hospital. I was allowed to leave. He had to stay for another week. And so the photo in the front is me holding him in the NICU with the feeding tube again. And then in the back is when you leave Providence St. Joseph. It's the unloading sign where they come and wheel you out and put you in the car and send you on your way. So this was kind of like unloading, like it's all over. I can get over and process it and shed the weight of this sort of experience and trauma that I went through. But realistically, I think the real healing didn't begin until I started actually making this series. Yeah, this photo, so my oldest son is the taller one, and my youngest son, the baby, is the little one. And so I call this milking for attention, because I had to pump milk while I was in there because he couldn't breastfeed yet. So we started doing that. Oh, and by the time he wanted to start breastfeeding, I was already dried up, but minor things. So my kids were always fighting for attention because my oldest son was 3.5 at the time when I was hospitalized, and he didn't get to live with me in the hospital. So he was only allowed to come visit me when my mom or my ex could bring him over to see me. So for him, it was just as traumatic as it was for me of an experience. And so the milking attention concept is like, I had this one kid in the NICU, but I had this other kid at home, and I have to like pull my time between the two because I can't ignore my oldest son and pay attention to my youngest son, who may or may not live through this NICU moment. So this photo kind of represents that sort of pull.
Well, that's a full day.
Yes.
Let's get back to you. I really want to talk about the stress on you in situations like this. And, you know, as we talked about, so maybe 25 to 30% miscarriages, problems like this. You're the gatekeeper of the news. And, you know, I'm sure when you were going through medical school, like a lot of these guys, it didn't occur to you that something that could be so joyous could be so stressful for you to tell people. So tell them what they might be in for if they go into this field.
I mean, I think you're touching on something that people don't talk about very much when they talk about OBGYN. That's my specialty. I'm an OBGYN. People are pretty familiar with the, joy of childbirth, and I actually still really enjoy that. That I actually don't get to do as much anymore. We have our, our resident physicians and our midwives are doing the healthy births, but I actually still really love to see that and feel privileged to be part of that, and our students will get a chance to observe some of that. But then as an OBGYN, actually my role more actively is for women who are having complications and trying to, diagnose what the complication is. It sounded like you had quite a lot going on. It was probably unclear what was the major problem and what was the best thing to do, which is, very stressful. And then certainly the decision of when to deliver you, so if we know that it's going to, if we know that it's going to be okay, if we had the crystal ball that we knew what the right moment was, we'd try to keep you pregnant for as long as possible, because when we deliver a mom early, the baby will be in the NICU and have, the earlier the baby's born, the more complications they have, being able to feed, being able to breathe on their own, problems with seizures. So that decision is, kind of the OBGYN's decision of, no, we can't wait anymore. We have to do the C-section. We have to do an emergency C-section. And, this was a success story. Mom and baby came out alive and healthy in her home, and yet, it's a pretty traumatic birth. Like, you described it as, the baby was ripped out of you. That's a traumatic experience for everybody. So, and stressful for the doctors in terms of, we go through residency training to learn how to do a C-section as fast as possible to kind of intervene and kind of save the baby during a complicated moment, whatever is going on for the baby. So for sure, it's a high stress field. I would say that I like it. I'm called to these problems, and I find the medical problems and the patients really interesting, and I have a connection with it. I imagine Dr. Dossett does too. The types of problems are really interesting. I touch on it in repro that, being in reproductive medicine, we deal with a lot of emotion, and I like that about it. So that's part of what drew me to the field. But it's a lot to take home as well. Like you've made this beautiful photo series to process some really difficult emotions, and we as physicians are often putting aside our hobbies because we're trying so hard to learn all the medicine and all the surgical techniques. But you need those too, because these emotions from the other side of the surgical drapes are really hard to deal with as well. So it's important to have ways to process that.
So, excuse me, you had mentioned this was sort of the beginning of the end of your marriage. Mm-hmm. And then you probably have to deal with a lot of couples going through this. And, they always say the worst thing for marriage is redoing your kitchen. But I would think that this could be worse. So.
Fun? Yeah. Oh.
That was inappropriate, but my microphone was off. So
Oh, you're
nobody
good.
can see you. Yeah, I mean, there are definitely statistics about marriages that fall apart because, my field is psychiatric, so the ones I'm familiar with are when women have really severe pregnancy and postpartum related depression and anxiety. And that's a risk factor then for the partner or the husband to also have anxiety and depression. Sometimes the partner maybe demonstrates that or has different symptomatology. Sometimes it's much more in the realm of substance abuse or anger or irritability. But marriages absolutely fall apart because of these sorts of strains and traumas. Yeah, it's not easy.
They too, domestic violence goes up during pregnancy, and so that tends to be a big taboo. We think that this is, this precious pregnancy and everyone must be in support of it, but the stressors increase a lot, and so domestic violence increases during pregnancy for sure, and then, postpartum complications as well can be huge stressors for families.
How was your first pregnancy? Did you have any troubles with that, or was that easy one?
I had preeclampsia, and then I had eclampsia after he was born. It's fun when you have a seizure and you're walking sideways, and then your nanny who's helping you has to call 911 and rush you to the emergency room. But so I had preeclampsia. So when I started this pregnancy, I was already high risk because they were looking out for that because my blood pressure is always through the roof. But yeah, my first pregnancy wasn't as dramatic, but it was stressful also because it was like a first pregnancy. And then having to go twice or 3 times a week to get ultrasound and get all my vitals done, that was kind of stressful too. But this one, I was hospitalized instead of having to go through that sort of drive-through process all the time.
We're coming up toward the end. If anybody has any questions for anybody on stage, there's a microphone over here, so feel free. So did you see anything in her list of her care and her timeline that maybe you would have done differently, or do you think they sort of did the right job all the way through?
I mean, that's where it's very hard because like in medicine, we're looking at outcomes and we're like, this is a successful pregnancy. And yet, is it a success if it's so traumatizing for the family and for the mom? We have moved away from prolonged bed rest because it tends not to be the thing that helps the most, and it causes so much like distress for moms. But your practices change. You mentioned a couple of times that really scary experience of kind of bleeding from your eyes and nose and IV. That can happen in pregnancy. It can happen like when you've been pregnant with kind of prolonged bleeding complications. Your body basically loses its ability to form clots, and you can bleed from your eyes and nose, and that's terrifying and terrifying for everybody. But it's difficult to know when you're having complications very prematurely in pregnancy, when is that point to pull the plug and say, now we have to deliver you.
Well, at 6 weeks, they were telling me at 6 weeks, we're going to deliver the baby at 34 weeks, so let's focus on making it to 34 weeks. So they told me that before I got to the hospital at 6 weeks. And then, so that's why I was at home bed rest. But when I got to the hospital, I was like, no, there's no way you guys are delivering me. I'm not having a preemie. I'm not going to deal with this. Because they took me up to the NICU and let me do a little tour of it. And you see all these micro preemie, like 1-pound babies in there, and it's traumatizing. And I was like, I don't want to go through this. So I fought it up until the last second. And my thing that convinced me to go ahead and let them do the emergency C-section was, my in-laws are coming in a few weeks, and I do not want them here when I have this baby. You laugh, but so anyway, it goes a little deeper than that, but let's just leave it at that. Yeah.
Would you have ever thought of having a third child after going through all this?
Yes, I want a daughter, but I was told never to get pregnant again because I might die next time. That's what my doctor told me before he retired. Yeah.
So I want to talk about one thing, and I guess, Dr. Schaff, I don't know if you want to jump in here since we don't have any questions. I always think of, when I was a kid, I had a lot of severe bone pain, and then when I think about it, later on, you can't even imagine the pain. And I've always heard doctors say, if people remembered how much pain they went through, they'd never have a second child. And whether you think this is true. I've never actually asked a doctor whether.
I think depending on the individual, if they feel that kind of biological and psychological urge to have a child, it's pretty strong. And I would say that there's a lot, I think hormones are powerful. So you go through this extremely painful process, and then you go through all these bonding hormones of, bonding with that baby, taking care of that baby, and it does make all of that pain more distant and less like pressing. And so we do see moms who've gone, so you were told another pregnancy might kill you, and we see a lot of people who come back and they're like, wow, I want to try again. And so it's actually our job to try to find a safe way, if that's what you want, to help you do that. Not everybody would agree with that, but I think, I think to take people's options off the table, there's a lot with that as well.
And there are options too, like surrogacy and ways to actually have a genetic child that don't necessarily involve all of the risks.
It's not the same, though.
It's not the same.
Because I love being pregnant. I mean, that's the healthiest I've ever felt in my entire life, is when I'm pregnant. And when I'm not pregnant, I don't feel healthy. So, I don't know, it's weird. Yeah.
But I think it's really interesting that you say that.
Yeah.
Even after this experience, there's a lot positive that you drew out of it as well.
I have a question.
Yes.
First of all, thank you to all of you for your contributions to this conversation. I'm wondering, this is mostly for the doctors, I think. Cathy's work is obviously so helpful in sort of healing her narrative, even the language she uses in terms of like stitching or the way things are merged to help her find words for the chaos and the trauma that you experienced. And I'm wondering if in your practices, if you have either encountered other patients who use art in this way or have other ways of sort of helping to process what they're experiencing, or if it's a part of therapeutic intervention for people who are in the hospital. Is that a part of practice by any chance in your field, particularly, Dr. Dossett?
Sure. So I can't really speak to the inpatient piece. I'm primarily an outpatient physician. But I have had women who do, in particular, use writing. I've had, I wouldn't say it's for publication, but who write, who journal. Actually, social media. A lot of people will post their experiences and use that kind of currency to help kind of find support and connection with other people. So, and I've had patients who have come in and not really been able to talk about what was going on, but they'll actually write us a letter and give us a letter later. They just needed that time and space to be able to articulate what it was that was going on. So people do use different means of processing / communicating what it is that they're going through.
I would say we don't have, and it's definitely an area to develop, we don't have a lot of kind of ongoing patient support resources, especially for admitted patients. We have social workers, we have chaplains for spiritual support. I think inpatient, I see a lot of my patients turning towards spiritual support. But I liked how you described, these pictures you came back and put together, but you have all the individual images that you were posting as they were happening, and it was like a record for you of what was going on, and also with that fear that you're not sure how this is going to end, that people could see what happened to you. And I think social media is like one of the beauties of it. It's really helped us talk about things that there was no forum to talk about it before. And pregnancy loss and pregnancy complications is really one of those areas. It used to be, who did you talk to about these really complicated outcomes? And now there's really great support networks on social media, and I can point patients to that as well. So Sisters in Loss is one of the ones that I use a lot. So you don't have to live in a city to be able to access women who understand some of your experiences and can also direct you to other experiences as well.
I have a question. If you don't recommend bed rest, what do you recommend instead for patients?
Usually what I tell them, because there's a very, very high level of anxiety and a lot of guilt, a lot of if something goes wrong, I shouldn't have gone for that walk. I shouldn't have been exercising. Why was I exercising? And there really is, most pregnancies are going to go how they're going to go with very little nuances that we can medically change and intervene. And so what I tell people is to do activity that they're comfortable with. So it depends on there are some specific conditions where we would say we don't recommend having intercourse while you're pregnant. But for most people, they can have sex while they're pregnant, no problem. They can if they exercise before, continue to exercise. But don't start training for a marathon if you never did that before, is kind of how I say that. And exercise tends to help process stress and clear your mind and help you cope with things. And so I usually say, continue doing your regular activities, continue doing what you're comfortable with. Nothing that you do or don't do is going to be the one thing that changed how this pregnancy went.
So my final question before we wrap up is, you had the phone with you while they're bringing you into did someone take the phone away from you and say that's not sterile? What happened to the phone?
They let me take the phone into the NICU. That's how we into the emergency room. That's how we got the photo of my son laying on the table. I gave it to my nurse. Her name was Sarah. She was like my best friend while I was there because she was doing her 12-hour shifts 5 days out of the week. So we became really close. So I gave her my phone and I was like, yeah, go picture happy. Take photos of everything. I don't care how gory or ugly it is. I'm like, get me some photos just in case he doesn't survive that whole process. That's how that went. But she knew what I was doing already. She's like, oh, you're a photographer. You're documenting the whole series. Okay, let me help you. Yeah.
Well, thank you all for coming. Thank our doctors. We appreciate all your knowledge. Thank you for your photo series and sharing it with us. This is one of the more personal shows we've had here. Mm-hmm. And if any of you haven't seen it, we're sort of toward the end of the run. It's downstairs for 2 more days, so please be sure to check it out. And thank you all for coming.